Gulick, Dawn, thank you for being here with us to give all that information to all our doctors on what's been going on with on your end, and thank you for all you do for the healthcare profession and people around the world. I'm going to go ahead and give you the stage. Go ahead.
Thank you, Dr. Tony. I appreciate that kind introduction. And as stated, my name is Dr. Dawn Gulick, and I want you to know that I appreciate this opportunity to address the members of PI Doctors Elite. So I'm here because I'm the inventor of the Mobil-Aider orthopedic device. This orthopedic device is the gold standard for assessing joint laxity. I'm going to share with you how this versatile, portable, and affordable tool for quantifying linear translation of a joint can provide you with valuable objective data and increase your practice revenue. So orthopedics is about precision. Why is it acceptable to wiggle a joint to determine the magnitude of an injury? We can and we should do better than that. So imagine this scenario. You're asked to evaluate a patient with a knee injury. You know the Lachman's test is a clinical technique used to assess the ACL. However, you attempt to perform the test on an individual's leg that's so large you can't grasp around the tibia. So identifying the joint laxity becomes a significant challenge. However, the Mobil-Aider quickly and easily straps onto the leg so that you are not required to grasp the leg, right? You just simply press down on the distal femur to stabilize it. You cup behind the proximal tibia and you translate anteriorly. You immediately see a digital display of the magnitude of translation in millimeters. Because of the contour of the device and the way it interfaces between your hand and the patient's limb, you still have the ability to assess the qualitative end feel of the technique while identifying the precise amount of laxity. The point I want to emphasize here is that you gain objective data without compromising the subjective feel of the joint. By comparing the uninjured side to that of the injured side, you have an appreciation of the difference between the two knees. Based on the research of Hamoud et al., where the Mobil-Aider values were compared to MRI results, they found that a 2 millimeter difference between the knees correlated with a partial ACL tear, whereas a difference greater than 3.35 millimeters correlated with a complete tear. This is valuable objective data, and furthermore, it's dynamic, unlike the static image you get from an MRI. I'm sure that all of you are excellent clinicians, but I challenge you. Can you really tell the difference between 2 or 3 millimeters of translation when comparing knees, not only right to left, but in serial measurements on your subsequent office visits? This data allows you to make good clinical decisions on how to manage these patients with quantitative information, not just a wiggle. I want to be clear that the Mobil-Aider measures linear translation in millimeters. It does not measure force or angular motion. These measures are not what's important in measuring joint laxity. A study by Tuzan and Carlson comparing the Mobil-Aider to electromagnetic motion analysis revealed a 0.83 correlation in the assessment of shoulder laxity. This is consistent with the bench research we did, showing just a 2% error, and the in vivo research that showed just a 5% error. These low margins of error should give you confidence in the ability of the device to give you accurate information. Notice I said just 2%, on bench and 5% in vivo. And this is recognizing that there is a little more error that has to be factored in when you're talking about placing it on a person versus in a bench lab, right, where you're placing on a person where you have some soft tissue compression. Additional studies are currently underway. A study comparing the Mobil-Aider to clinical diagnoses of the ankle is currently in progress. By switching out the attachments on the Mobil-Aider we're able to assess lateral and syndesmotic laxity of the ankle. To date, data on 9 patients are showing a difference of 1.5 to 2.5 millimeters of translation is corresponding to a clinical diagnosis of a grade 2 sprain. Stay tuned for the publication on that study in the coming months. But data and versatility are only part of the picture. The Mobil-Aider increases your practice revenue. That's right, the Mobil-Aider can increase your practice revenue. A 97750 physical performance code carries a reimbursement of approximately $35 per use. Of course, that depends on your geographic region. It's plus or minus $35 per use. And you have to be careful you cannot use it with an evaluation code, right? But this code is available for your use. The criteria for billing a 97750 code is a written quantitative value documented in the medical record. The Mobil-Aider provides this quantitative value and allows you to capture that untapped revenue. So remember, that's a 97750 code. This is a substantial amount of money. For your convenience, we've actually provided a revenue calculator on our website. By going to mobil-aider.com, that's MOBIL-Aider, AIDER.com, so there's no E at the end of mobile, MOBIL-AIDER.com, you can enter the number of times that you use the device per day. And the revenue calculator will estimate your annual income. So just as an example, using the Mobil-Aider one time per day will generate $9,000 per year for you. Okay, that's just one time per day. $9,000, right, of clinical objective data. In busy practices, this number may be doubled or tripled annually. I'm sure you could use that increased revenue while providing you, your patient, and the insurance carrier with quantitative data. So let me provide you with a few more pieces of information. I imagine you want to know what this device costs. Well, you have 4 options. You can purchase joint-specific kits for the knee, shoulder, and ankle if you tend to have a preponderance of one joint in your practice. These kits retail for $19.99. They retail for $19.95. I'm sorry. The kits retail for $19.95 each. They include the device, attachments for the respective joints, charging port, a charging cable, and they're packaged in a portable 9x13 padded plastic case. So it's easily transported between treatment rooms or offices. Did I mention that the device only weighs 13 ounces? Just 13 ounces. It literally fits in the palm of your hand. For those of you that remember the KT1000 device for the knee, although it's not available anymore and hasn't been commercially available since 2012, it was huge. It fit in a suitcase. It required significant setup and was never validated. In fact, there was a 28% false negative rate associated with the KT1000. This is because there was an interface error. By this I mean the KT1000 used a handle to pull the tibia forward. This resulted in the device being pulled away from the tibia. This gapping produced measurement errors. When you're measuring millimeters of error, right, or millimeters of translation, you can't afford these errors. Well, we recognized this problem and we solved it. The Mobil-Aider captures the tibia and pulls the device and the tibia together as one unit, hence reducing this error. So getting back to your purchase options, we have 3 custom kits, right? But if you tend to have a variety of injuries that you assess in your practice, the Deluxe kit. The Deluxe kit is available, right, and retails for $24.95. The Deluxe kit includes 7 attachments, straps, a handsome countertop docking station to conveniently store all the attachments, a charging port, and a charging cable and plug. For PI Doctors Elite, we're offering a special discount of $500 off these retail prices for orders placed before the end of February. This is a $500 off the retail price for any kit or deluxe model. Given the reimbursement, you'll recover that cost in a few weeks. So you can email me, dawn@mobil-aider.com, and I will personally process your order with this discount. So although we have a comprehensive frequently asked section in our website, please allow me to address just a few questions you might be thinking about right now. One, exactly what joints does a Mobil-Aider assess? Well, there are 7 interlocking, color-coded, custom contoured attachments available to test more than 14 motions of the extremities. This includes shoulder, elbow, wrist, knee, and ankle. We're still perfecting hip and spine testing. 2, is the device validated and reliable? Well, yes, we have 8 published studies to date and 2 in process. The studies revealed that the Mobil-Aider is valid when compared to radiographs, Zeitz Smart Zoom, and electromagnetic motion analysis. Both intra and inter-rater reliability has been studied. Although intra-rater reliability is better than inter, both have been found to be good to excellent. Is it FDA cleared? Absolutely. The device is FDA cleared and the U.S. patent has been issued. And as Dr. Tony shared, I might also add that this device development was supported by funding from the National Science Foundation. I'm very proud of that fact because it's not an easy grant to get. And the fact that the National Science Foundation believed in this device speaks volumes. Is the device rechargeable? Yes, it comes with a charging port, cable, and plug. The duration of the charge depends on usage. It will last several hours of continuous use, but from a practical perspective, you'll be using it intermittently throughout your day. So we simply advise that you keep it docked so the device is ready when you are. If the device is off, it will hold a charge for many days. I provide you with an example of the testing of the knee using the Lockman's technique and the Mobil-Aider in the beginning of this presentation, but I want you to know that the use of the device has a minimal learning curve. Right? Once you identify the proper attachments, the clinical techniques are very similar to what you're currently using. To that end, we provide you with a laminated, quick guide that comes with the device to easily identify the correct attachments right in the clinic. But our resources don't end there. We have resources on our website, mobil-aider.com, mobil-aider.com, and there are learning modules with videos, user manuals, and the published manuscripts. So to wrap things up, allow me to briefly give you a couple clinical examples. Let's say you have a patient with shoulder instability. You want to test anterior shoulder laxity. You place the patient prone with a towel roll underneath the clavicle and anterior thorax. You don the blue attachment on the Mobil-Aider device, which will be much clearer to you when you look at the Mobil-Aider device on the website as to what that means. There are dovetail attachments that the device slips right into to hold those attachments firmly in place. All right. You align the device with the axis of the glenohumeral joint line, and then you translate the device anteriorly with pressure on the proximal posterior humerus. This gives you an immediate quantitative value on the LED screen of the linear translation in millimeters. And then obviously you can compare that to the other side or the uninjured side. Please understand that there are no normative values for this device. There aren't now, and there is no intent to gather those because the other side is what is normal for that individual patient. Another example is if you want to test ankle laxity, say for anterior talofibular sprains, right? You don the yellow attachment and you perform an anterior glide or an anterior drawer, right, of the talus and calcaneus on the tibia, right, the talocrural joint. If you do don the green attachment, you can do a cotton test, which, as you remember, is a lateral translation of the talus on the fibula or into the fibula for syndesmotic sprains. So as you can see, the accuracy and the versatility of the device makes it the gold standard for joint assessment. If you have any other questions, feel free to visit our website, mobil-aider.com, or email me via Dawn, D-A-W-N, Dawn at mobil-aider.com. I'd be happy to answer any of your questions or take your orders for the innovative orthopedic device. Remember, you get $500 off the Mobil-Aider for any of the custom or deluxe kits until the end of February. All I need is a PO to hold that price for you. I thank you very much for your time. I appreciate it, and I wish you good health and continued success in your practice. Thank you very much.